March is Colorectal Cancer Awareness Month, and we're sitting down with Dr. Robert Harsin, a surgeon with Genesis Health Group Davenport Surgical, to find out what you need to know about colon cancer. So, doctor, what is colon cancer and who is typically affected by this diagnosis?
Colon cancer is a disease of the colon. That's the part of the intestine just before, for example, where stool would come out.
Okay.
And so people who have colon cancer are people who have, for example, a polyp that grows into a tumor that we would classify as colon cancer that could be a problem for patients.
And what are some of the signs and symptoms?
Unfortunately, a lot of times early colon cancer doesn't have a lot of signs or symptoms. A lot of times colon cancer, when it gets large enough, it will either bleed or cause an obstruction or cause pain, or people can feel a mass in their abdomen. That's when it becomes notable. And it's a little bit later on in the disease process at that period of time.
Okay. And talk to us about the importance of patients being screened. What does that entail?
There's a couple different ways where people can be screened for colon cancer. My favorite way would be for people to have a colonoscopy. The general starting age is 45. This involves passing a scope of the colon to look for colon polyps. There's other ways to look as well, things like Cologuard or a fecal occult blood test. That's where stool samples are taken to look for tumor or blood.
Okay. And why do you think a lot of people don't get screened?
I think that a lot of people are afraid of the process.
Yeah.
It's pretty straightforward, and we'd like everyone to at least consider having a colonoscopy so that we can prevent colon cancer before it gets too far beyond. It's more difficult to treat.
Definitely. All right. Well, doctor, thanks so much for taking the time to talk to us today.
You're welcome. Thank you.
All right. This was your Genesis Medical Moments. And for more information, you can go to ourquadcities.com and click on the medical tab.